Hi, I'm Beth Gaddis, the Vice President of Marketing at Patient Prism, and I'm delighted to welcome Christine Taxon to our studio today. I'm so glad that you could join us.
Thank you so much for having me.
Oh, it is our pleasure. Christine is one of the top renowned experts in medical dental cross-code billing. You have taught at Harvard, you taught at NYU's dental school, you travel all around the country teaching people at symposiums done by Henry Schein and Patterson Dental. You're going to be at ADOM again this year, which you have been at many times in the past. And she is so abundant with sharing her knowledge about how dental practices can be maximizing their patients' benefits by billing codes to medical insurance when appropriate.
Right.
So thank you for sharing your knowledge with us today.
Oh, thank you for having me.
So we had let some of our customers know that you were coming, and we had asked them for some of the questions that they had about medical billing. And one of the questions that came up was some tips for greater claim success. One of them is using medical billing right now, but they said that sometimes they get the claim rejected, and they were hoping that you could share your knowledge about how to overcome that.
Oh, I would love to. Well, the first thing that most dental offices don't realize is that medical doesn't know who they are.
Okay.
Because they've never billed medical.
Right.
So you have to be able to submit paperwork to them just to let them know that you're going to be billing.
Okay.
So they need the business MPI, and it must be a business MPI, or, you know, because checks are written only to the business, not to the provider.
Okay, that's a good tip.
Okay, and then they absolutely need to pre-authorize. If you don't pre-authorize, if it was an emergency, I would say that's the only time.
Okay.
But you want to verify the benefits, and if you verify them correctly online with one of these free sites that we offer, you will be able to even see what codes need to be pre-authorized before you use them. So
Okay.
people think they can't do anything, but it's really, every company has their own set of rules.
Okay.
So if you're doing an exam that day, it doesn't mean that you can't bill it without pre-authorizing. Just know when you pre-verify what codes need to be pre-authorized in advance.
It really sounds like you need to have your paperwork all in order. And you know, another thing that we talked about needing it to have in order is diagnostic codes.
Yes.
So talk a little bit about that.
Well, this is new for us. So this is an area of learning.
For
right?
dental practices.
For dental practices. Diagnosing a patient, because we're connecting with medical, so the patient is pregnant.
Okay.
But we're not treating her pregnancy.
Right.
So her pregnancy is a secondary code.
Okay.
It will never be a primary code for us. But we're treating her for periodontal infection. That would be her primary code, and her secondary code is her pregnancy.
So you need to include the medical reason that she is seeing you as a dental provider.
Because that is the reason she becomes a medical necessity.
Okay, gotcha.
So that's what I try to teach. Think about what you need to treat the way we would have before knowing about diagnosing.
Right.
You're looking at the patient, you're saying you're missing teeth, and we're going to replace them with implants. However, in the medical world, you're not replacing missing teeth. You're reconstructing the jaw, whether it's the maxillary or the mandible. So now you have to tell them that that's what you're doing.
Okay.
So they're going to want to know, how much atrophy was there?
Right.
How many teeth are we replacing? The full oral cavity or partial oral cavity? So it's really a story.
Right.
I teach diagnosing as a storytelling.
Okay.
I'm going to tell you a story, and I do teach that in the classroom. Tell me a story about why you think this patient is medical. And if you could think that way, you're going to learn diagnostic coding in order of what's needed.
And that is going to help you make sure that your claim gets approved.
Absolutely.
Well, and after you diagnose correctly and you've made that case, you need to also be able to tie back the treatment that you're going to do to what you've diagnosed. And that's a really key tip, isn't it?
Yes, that's really key, because if you're doing implants and you're putting in, the patient is completely endoless, so they have no teeth left, and they have severe atrophy, and we're going to be doing bone grafting and all these other things. When you're putting the procedures down, you always want to put the most expensive procedure first
Oh, I did not know that.
because medical pays the highest percentage on the first line item
Okay.
and then goes downward. And in dentistry, we put them in as we do it. So exam, x-rays, prophy.
Right.
Don't do that with medical. Do the reconstruction first, the bone grafting second,
Right.
and go down the line and go by the fee, not the procedure.
Well, Christine, those are fantastic tips. For if somebody wants to learn more about, cross-coding, what's a good website for them to go to?
They could go to dentalmedicalbilling.com and or ctaxon at linkstosuccess.biz.
And you're so abundant with your knowledge and sharing your information, so I definitely encourage everybody to go to the website to learn a little bit more or to email Christine. And thanks so much for joining me today.
Oh, thank you.